and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course,
Brad, I
Bob.
thought this is going to be a great video.
Yeah, I do too.
This is a video that quite often I run into. It's when you have to stand for a long period of time. For me, it's at athletic events. I don't like to sit, go to a cross-country meet or a track event.
Right.
And I'm standing there and I'm fine. I'm actually fine for about an hour. And then I start feeling it in my back.
Right.
And so these are some of the hints you can do to stop having pain in your back, your knees, your legs, hips,
Right.
when you've been standing too long.
Other option, people at work, a lot of times people have a workstation they need to stand at for the majority of the time. I have, in the clinic we have people doing dishes or just standing cooking is a long enough time to get their back irritated or their knees. Shopping. If I'm shopping with my wife and she's shopping hard, I'm standing there, my back starts to hurt even quicker. I don't know why, Bob.
I don't know why either. I wonder
All
why
right.
that's the case.
So what's one of the keys as far as what you can do? I think what Bob is doing right here. Now, we don't have a stool tall enough, but Bob actually is tall enough where if you find a surface to sit on that's just a little bit shorter than when you're standing.
Right.
So right now.
It's amazing how much pressure this takes off of everything.
Right. So now you got how much weight through your buttocks?
It's not
roughly
that much, really. I'd say 25% maybe.
But it feels much better.
Oh, it feels much better.
Right.
It's just, if you can lean against something even really to some extent,
right.
It's going to really help.
So just anything like a stool, if you got a bar stool or a stool that can change heights and you're just going to sit for 5 to 10 minutes, then you can stand for that 20,
Brad,
30 minutes.
talk about the work setting, especially if you're at a work setting where you are standing, they if they can get you a work stool that you can use, that you can actually just every so often briefly relieve the weight.
And I've worked with some people, some employers don't like to do that and they're misinformed. Their productivity is going to go higher. If these people have pain and if they feel relief when they sit down but can still work because the stool is only a few inches lower, it's going to relieve that pain. People can work better with that. Good point.
Can I take the next one, Brad?
You bet.
Okay, lock knees. I had a patient, Brad, that did this. He was working at Subway.
Okay.
And he would stand there and he would lock his knees back like this.
Yeah, so if you look at that.
Yep. How they lock way back.
Straight right here.
He'd stand there the whole time and his knee pain just got unbearable because he's just jamming the joint when you do that.
End range.
So honest to God, Brad, the only thing we did is we changed him. We had him stand like 1 foot in front of the other and had him slightly bend his knees.
Let's look at that. So we got a little fight and go straight once. From there to there. So, talking about 5 degrees.
Nobody knows the difference. And that took away his pain. Honest to God, that's all. That's all.
Sure.
But you stand for 10 hours or 8 hours, your knees locked like that, it's just jamming that joint the whole time. So, all right, what's the other tricks, Brad?
The other is weight shifting, or like what I was doing here at the beginning. If you can put 1 foot up like this, boy, it just changes the weight through your joints, through your back, and it feels much better. You're only going to stand like this for a few minutes, and then you can go back to here. If you're doing the dishes and you have that pain, open up that bottom cupboard door, and if this was a dish sink, you can put 1 foot up here like this and continue to do the dishes, or like this. Or otherwise, in my case, I get my wife to do the dishes, and my back feels real good on the sofa.
Oh, he's going to get slapped for that one. But anyway, I used to teach a back school at Mayo Clinic, and that was one of the things we taught. And people really gave really good feedback on that, of putting their foot into the
Right, it's one of those tricks that almost everyone has in your house.
What's the last one, Brad?
This is what I do. If you're anybody with spondylolisthesis, I can help you. Right, but we got a lot of people on our channel with that. If I squat like this, it feels so much better. And I may hang out like this just for about 20 seconds or so, and then I'll get up like that. Or if you do this and squat forward, if you're having that low back pain, and if it's the right thing for you, you will feel relief immediately.
Sure.
It's one of those things that it just, right now it feels better, and then you can go back to your standing.
Well, the one that I like to do actually is to put my hands on a higher surface like this and do what is called, there we go, cat camel.
Right.
Where I make is that a camel?
I don't know.
Cat.
Yeah, I don't know. Round it and
camel.
There you go.
Yep, just getting some movement in the back feels really good. So, just go up to some surface that's about the right height and go ahead and get some movement in the back.
More people are probably going to be like this than like me, though, where the rounding. You know, if you got stenosis or spondy, then the squatting or the sitting will probably help.
Right, exactly.
But that's another story, Bob.
All right, Brad, enjoy your shopping trip next time, because I'm sure next time now she's going to make you go longer yet.
Yeah, and the dishes,
video.
yeah, she's not going to watch this video. We're going to kind of stealth it.
Sending it to her. Thanks for watching.